Asia, of course, has suffered through a series of health crises in recent years, most recently the SARS outbreak in 2002 and 2003, which is why we wanted to devote part of our program tonight to Asia and how it is dealing with this outbreak. And for that, we are joined by Simon Tay. He is with the Asia Society in this country and is the chairman of the Singapore Institute of International Affairs. Thank you very much for joining us on the program.
Thank you.
Hong Kong was criticised for its delayed reaction to the SARS outbreak. How are the authorities there responding to the current crisis?
They're much more prepared. In fact, one could say they're perhaps a little bit over-anxious to prove that they have the political will to shut this down. Like a lot of countries and cities, really Hong Kong is struggling between this idea of containment to try to prevent the disease from spreading in, or the idea of mitigation. Well, how do you respond to it once it's in the country? And
you just returned from Singapore and from Hong Kong. How is the story playing out there?
Well, I think it's early days. I think people have got a certain sense of fear. There is a sense of, well, is it happening again? And will it affect the economy? I think as much as public health, Asian countries are very concerned about the economic repercussions.
And is there any evidence of that?
Well, it's more a historical issue. When SARS really hit Asia, we really saw a full quarter where the economy was completely disrupted. Restaurants were ghost towns, hotels were like 10% in Hong Kong, and really demand fell off a cliff. And that was in a relatively good time. Imagine now if there's a global crisis going on which is affecting the economies of Asia, and then on top of that, you have another big public health scare. I think that's the kind of scenario that Asian countries are concerned about.
And in the light of these concerns, what are the governments doing so that the public doesn't panic, so that people stop taking flights into Asia?
In fact, I think that's where the two strategies of mitigation and containment are a bit in tension. Some people are trying to actually contain themselves against Mexico and trying to really signal very early on they're taking tough measures. I think fundamentally, though, the Asia-Pacific today is so interconnected, we can't do that. And this virus, from what we've read, seems to be easily transmitted, so that it's inevitable that there will be a growing number of cases. Over the weekend already, Hong Kong, South Korea, and others have discovered there are cases.
And what countries do you think are best equipped right now in Asia to deal with H1N1?
Well, I think almost all the Asian countries, because of the experience in SARS and with the bird flu, really have had that open line to the WHO, have had these sort of standard operating procedures which will dust off and try to implement regards to SARS, the present crisis. The problem is that despite these standard operating procedures in place, the capacity really differs. I mean, we're talking about Asia, which is so diverse. We've got rich countries, countries with capacity, countries with control over their borders, good public health and good hospitals. We've got other countries with very few of those same strengths.
So which countries would you say are the least prepared then?
I would say the developing countries. Countries where there aren't enough medical doctors and training to really track epidemics. Countries like Cambodia, large countries like Indonesia will be vulnerable. And similarly, in the stock of the hold of Tamiflu, of antiviral medicines, again, the larger, poorer countries are more exposed than, say, Japan or Singapore.
What would happen if there were an outbreak in those developing countries in Asia? How would the health infrastructure deal with this crisis? Presumably what you're saying is that they wouldn't be able to, so then where would the help come from?
Well, that's the thing. I mean, though the World Health Organization has ramped up its services, it is not in the capacity to really supplement in a very strong way the existing public health authorities in a country. They just simply don't have the kind of doctors to put on the ground. So it will depend instead on the abilities of the country itself. I think a lot will have to do with the nature of the outbreak. You know, in the end, we must remember, going back to SARS, that the outbreak was relatively small, relatively few people died, and relatively short period. If we may be looking at something like that, then Asia, like the other regions of the world, will be able to cope. At this point in time, though, it's very hard to say.
So you're encouraged by the data that we have right now, which is saying that this is a mild strain of the flu, even though the WHO is on pandemic level number 5.
Yes, well, it will spread. The thing is, how deadly will it be when it spreads? And the intelligence coming out right now is that it seems to be moderating. We don't know. But I think that Asia, after the SARS experience, realizes that there is a danger of first reacting too slowly. Secondly, once you've realized you've acted too slowly, letting the fear become a problem for really tackling the issue itself.
Mexico's protested China's decision to quarantine a number of its citizens in a hotel in Mexico City. What do you think comes between these two trading partners?
Well, actually, Mexico isn't an isolated country in terms of the production between Asia and the Pacific. Mexico is part of NAFTA, so a lot of Asian countries trade with Mexico to get into the North American market and the USA. So it will not be easy to isolate Mexico economically and isolate Mexicans from traveling within these two countries. In fact, trade between China and Mexico grew phenomenally in 2007, 2008. And so we are seeing the question, which is quite different from SARS. SARS really was an epidemic basically in Asia. Here, we are seeing the numbers coming out that not only is it Mexico, but it's this country, the USA. And there's no way that people could or would want, in a way, to really contain themselves against the USA and travelers from the USA. It's impossible.
Okay, Simon Tay, thank you very much for joining us.
Thank you.